Tonight at 10, a wave of summertime COVID is here. The Alabama Department of Public Health says there's been evidence of that COVID affecting all of us, as we know. But with your kids back in school, what are they doing to help keep them safe and to help them fight the virus? WAAY 31 weekend anchor Rob Sneed went straight to the experts and local school officials to get some answers. Rob.
Good evening to you, Nicole. Tonight, health officials told me that this round of COVID is nowhere near as severe as it was back in 2019, but they still tell me that folks are getting sick, including kids. I'm also told that school districts nearby are all pretty much following the same protocol. Class is back in session, and unfortunately, right now, both adults and kids are at risk of getting COVID.
Some parts of the U.S. have seen some increases in the number of hospitalizations, in the number of positive tests that are being reported. And that's reported regionally. There has been some evidence that there have been sort of a summertime COVID wave.
Despite the increased numbers, Dr. Wes Stubblefield with the Alabama Department of Public Health says over the late spring and early summer, the Centers for Disease Control and Prevention backed away from making specific COVID recommendations for the general population. That includes school-aged children. He says at this point, health experts are warning parents of the big three respiratory viruses, RSV, flu, and COVID, none of which are completely avoidable.
We recommend that school districts use CDC's guidance, when they look at their policies for kids coming back to school. This has been pretty common among school systems in the past when it has come to things like flu or other viruses that kids get.
Several districts in North Alabama pretty much follow the same guidelines. Huntsville City Schools says it follows the CDC respiratory virus isolation guidance for illnesses such as COVID-19, the flu, and RSV. In a statement, it said in part, quote, individuals may return to school and normal activities if the following is true for at least 24 hours. Symptoms have mostly resolved with overall improvement, and if a fever was present, the fever has been gone without the use of fever-reducing medication. Madison County School System also sent WAAY 31 a statement that reads in part, quote, as for when students may return to campus, MCSS continues to follow the ADPH CDC guidelines that are standard for most any infectious illness. Fever, vomiting, and diarrhea free for 24 hours before returning to school, end quote.
Feeling better, that means that they can participate in activities and learn and, stay awake in class. And so it's a little bit different for kids because obviously as adults, we can do things differently. But for kids, they really need to be, on the mend and especially fever free. And for more information on the guidelines, you can go on the CDC website. And of course, we'll have that linked on our website at WAAYTV.com. I'm reporting live with coverage you can count on. Rob Sneed, WAAY 31 News.